Friday morning, welcome back. 9:20. February is American Heart Month, and it's a month dedicated focusing on heart healthy habits to help prevent cardiovascular disease, which is the leading cause of death in both men and women.
Joining us now this morning to talk more about the important topic is Dr. Nandish Thukral, an interventional cardiologist at Methodist Hospital. Good morning.
Good morning.
Thanks for joining us, doctor. All right, let's dive right in. What can people do to lower their overall risk of cardiovascular disease?
Sure. So, the good thing about cardiovascular disease is, as prominent and as it is that there's a lot of things that people have under their control. So there's several lifestyle measures that can be taken. So obviously eating a nutritious, healthy diet, maintaining an ideal body weight, getting regular exercise on a daily basis, all those things can lower people's cardiovascular risk. There's obviously the healthcare side of things where people need to be seen regularly by a primary care physician or a cardiologist to maintain their blood pressure at optimal levels, their blood glucose at optimal levels, and their cholesterol levels. So a lot of those things are manageable either with lifestyle or with regular medical care and pretty routine medications.
And Dr. Thukral, what signs may indicate someone has something wrong with their heart?
Yeah, so the symptoms we always want to be very weary of and leery of are things like discomfort in the chest, pressure in the chest, shortness of breath, especially those things occurring with activity. So when someone's trying to exert themselves, if they're having symptoms like that. Other things that could spell a problem is things like dizziness, palpitations, or feeling the heart irregular in their chest or fluttering, certainly loss of consciousness. All of those things would warrant a trip to your physician and perhaps a cardiac evaluation.
Doctor, what's the difference between a heart attack and cardiac arrest, and what symptoms might present for each of those?
Sure. So this is a very good and timely question, especially after the events a few weeks ago with our NFL teams up north. So a heart attack is a very specific event when one of the coronary arteries, that's the artery or the blood vessel that brings blood to the heart, gets blocked essentially very abruptly. So you develop a blood clot and you begin to starve the heart muscle for blood. That's a very unique situation. A cardiac arrest is a little bit of a different situation where you actually develop an abnormal heart rhythm and the heart stops or is unable to maintain adequate, what we call perfusion or blood flow to the entire body, including the heart muscle, the brain, and other vital organs. Heart attacks are caused by a blockage. Cardiac arrest can be caused by a heart attack, but can also be caused by other things such as blood clots in the lungs, bad infections, significant bleeding from traumatic events. And the symptoms, obviously, of a heart attack are the things we just discussed, things like chest discomfort, shortness of breath. And a cardiac arrest is going to happen very, very abruptly, sometimes without any symptoms at all, where someone literally just collapses in front of you without any warning.
Yeah, I mean, we've all been talking about this now for weeks since what happened with Damar Hamlin with the Buffalo Bills, and that's what you were alluding to.
Correct.
Yeah, well, thank you for addressing that. And also, what type of care does Methodist Hospital offer in treating the most critically ill patients?
Sure. So, heart attacks come in a variety of flavors. There are some that are mild, and that's a little bit of an unusual concept. But people with fairly mild or straightforward heart attacks can be treated almost anywhere. But patients with really significant and large heart attacks that are often associated with a significant amount of heart muscle damage or cardiac arrest are really treated best at a place like Methodist, where we have what is called a cardiogenic shock team. We actually have paired with San Antonio Fire and EMS to become a resuscitation center within the city, where we can rapidly deploy anything that a patient might need who's suffering that kind of a very, very profound cardiovascular event. We've got all the physician specialties necessary. We have an amazing cath lab team. We've got amazing nursing care that really drives the patient care from the minute they enter the door. They can be treated with really any modality, including mechanical circulatory support, angioplasty and stenting, open heart surgery, even heart transplant, to hopefully get them through that hospitalization, get them back to a normal level of function, and then back home with their family.
Fantastic. All right. Well, I think we covered all the bases. Dr. Nandish Thukral, of an interventional cardiologist at Methodist. Thank you for your time, sir.
Thank you for having me this morning.
Keep up to date with all of San Antonio's top news, weather, and so much more by clicking the like and subscribe buttons below. And once again, thanks for watching KSAT.